If someone needs an egg donor, you screen them for any genetic illnesses in the family so that the egg donor often has a more clean, perfect, blank history for any problems than the patient themselves that needs the egg donation. We're very, very, very cautious and careful about that. The FDA regulates this, at least the infectious disease side of it, and we all have to really satisfy FDA requirements. And the FDA doesn't just routinely check you here and there. They make spot checks. It's unannounced. They just show up in their uniforms, and they don't give you a chance to prepare, really, because they want to see what's going on. So it's pretty well controlled. And the chance of an egg donor having a genetic problem, we have genetic screening for recessive diseases. A chance of having a genetic problem either with them or the family is really very, very remote, less so than the patient herself with her own eggs. So I think you can feel comfortable with the screening. One thing I tell you about egg donation, if you run out of eggs and you need donor eggs, and that's the only choice you've got, we don't have any unhappy cases. And I believe the reason we don't is it's easy to match for appearance and background and race and whatever you want to match for. What you can't match for are intangibles that you care most about: personality, character, intelligence, emotional stability, and bonding with you as mother. And those intangibles are not in the DNA. We found out in 35 years of watching these kids grow up, and we don't have any unhappy cases, that those intangibles arise from how you interact with a baby in the first 2 or 3 years of life. And particularly if people are going through something like egg donation or even IVF in general, they are really tuned into that baby. And the kids just turn out fantastically because it's so important, those early years of life, when you might think it's just an eating, pooping, crying machine. It's really a sentient human being that is learning at a faster pace and developing at a faster pace than it will ever develop in the rest of its life. So we find that our egg donation cases are very happy, even though people would rather have their own DNA. If they can't have their own DNA, it still works out to be their baby. Let me tell you a funny story that goes back to 1976, because we didn't have IVF. No one really was very sophisticated about gender or trans issues like we are now. And a man came into the office. It was 1976. Big, strong guy. I mean, really macho guy. And he explained that the reason he's become so macho is because he really feels like he's a woman inside, and that didn't feel right. And so he's trying to make himself more of a man, but he just feels like he's a woman trapped in a man's body. So that would be like a male to female transsexual or transgender, however we used to call them, transsexuals. But he wanted to be able to have children. And so how is he going to be able to do that? I mean, and nowadays we have IVF and donations, but he's going to go on female hormones, have his testicles removed. I mean, how's he going to be able to have kids? No IVF. So I suggested that he look for dates in the trans community, and he's a male to female transsexual, and find a female to male transsexual. And without having any surgery or going on any hormones, they can get married and have intercourse. And of course, he feels he's a female and she feels she's a male, but they can still have normal intercourse. They wound up having 3 babies, a happy marriage, and they got along very, very happily. And they were the only ones that really knew they were trans. Now, maybe we couldn't do that in this day and age, but we go through all kinds of conniptions. But this was, before we knew anything, it was just my simple homemade remedy for his dilemma.